Hello and good evening to everyone. Good afternoon, wherever you are in the world. Today I'm talking about a recent change that has occurred with regards to YouTube and their censorship policy rules, and also a paper that has been published with regards to censorship and the misinformation that have been done by physicians across the US. So, very interesting paper. And I've got with me Sean Kaufman, who I've had before. He's public health, fascinating to talk to. He has really interesting views, and we're going to be jumping into introducing Sean in a moment. Before I start, I'd like to remind everyone that coming up next weekend is our post vax long COVID conference. Lots of international speakers. This is a very, very important topic. You have to look out in the week for links. It may be in the description afterwards, and you can register. But please make sure it's over 2 days, Saturday and Sunday. Make sure that you join us. They're getting lots of information that will be valuable. So, for those who are still with me, because these days a lot of the information seems to be suppressed, we will be having a very interesting conversation with Sean Kaufman. And so, I'll add Sean to the stream. I'll ask him to switch on his video temporarily and unmute. Hi, Sean. How are you?
Hey, Dr. Philip, I'm doing well. How are you doing?
I am well. Thank you very much for joining me. And Sean, he's taken time out of his busy schedule. He's on the road, and he said, "Listen, we've got to talk about this." So let's get an introduction for you, Sean.
Well, Dr. Philip, first and foremost, welcome everyone, wherever you are. Good afternoon, good evening, good morning. My name is Sean Kaufman. I do apologize to Dr. Philip because typically I would look a lot different than I do. For those who love tennis, I'm a big Wimbledon fan. For those who love tennis, we had a mix up, and this discussion is so important that I didn't want to miss it. And so I do apologize for my tennis hat, my tennis attire. But Dr. Philip, I appreciate the opportunity to talk to you and your audience. I acknowledge, in my opinion, you've done an outstanding job over the past 2 years providing good sound information to your audience. And so I just couldn't miss this conversation. And again, ladies and gentlemen, please forgive me for looking the way that I do. I'll go back to my avatar. But thank you again, Dr. Philip, for having me on your show today. I appreciate you.
Great. So I'll just ask you, Sean, to just do a quick introduction of yourself.
Absolutely. So, my name is Sean Kaufman. I have served public health for over 27 years. I am not a physician. I have a master's degree in public health, health education, health and human behavior. I started at the state of California with HIV/AIDS. I went to the Centers for Disease Control and Prevention in Atlanta, Georgia, and worked there for about 6 years. I started in HIV/AIDS, went into waterborne disease, and then when September 11th, 2001 occurred, worked not only to assist people at ground zero, but then was deployed to work in Trenton, New Jersey with the anthrax attacks. So those anthrax attacks that occurred in 2001. When I came back to CDC, I worked in emergency response. So I responded to the original SARS in 2003. I also responded to West Nile virus, monkeypox, H1N1 in Mexico City. And at that point, left in 2004 to Emory University, where I received an NIAID grant. You guys may know who runs NIAID. That was the former Dr. Fauci, to train people to work in high containment laboratories, BSL-3 and BSL-4 labs. I spent 10 years at Emory University teaching emergency public health preparedness and how to work safely in high containment labs with the most dangerous pathogens in the world. And in 2014, following the Ebola outbreak, I managed the isolation unit at Emory University for the first 2 cases of Ebola being treated in the United States. We started our own little business called Safer Behaviors, and we have been training people to work not only in high containment laboratories, but healthcare settings with very virulent infections. Again, our job and our focus is teaching people safer behaviors. How do you work safely around the most dangerous pathogens in the world? So that's kind of what we've been doing, Dr. Philip, and it has been a crazy last 2 to 3 years.
Wonderful. Great that you have. But this is the thing about you, Sean. You have such a vast amount of expertise, especially with the original virus. And it was so surprising, as you said, that people with your kind of expertise simply because you didn't necessarily align with what was being pushed forward were sidelined so that they couldn't hear anything else but what they wanted to hear. I always think that's a mistake when you don't listen to all of the sides of the argument.
It's a huge mistake. And in fact, over the 27 years of public health, I've been proud to call myself a public health professional, but not the last 3 years. I have felt like I was in the twilight zone. Things that we knew for a fact existed in public health, all the lessons that we had learned from decades of studying infectious diseases, viruses, studying immunity and immunology, all of the, even medications and treatment of medications, all of these things seem to be thrown away. And it was almost as if we were starting from scratch, and it just never made sense. And when someone would bring up something that went against the narrative, a classic example, Dr. Philip, is when I've always gone on emergency responses, whether it was Ebola or H1N1 in Mexico City or cholera or wherever, we never brought the sickest in our society to the hospitals, ever, because that's where people deliver babies. That's where cancer patients need their treatments. That's where people who have broken bones and they need people who need stitches go. Why would we bring people who are sick with novel viruses, the sickest of the sickest, to the hospitals so that we could actually prevent those who need care the most from getting the care they need, because now the hospitals are contaminated? So, just simple public health strategy like that were completely ignored. And anybody who would bring up their experience and try to challenge, why are we doing what we're doing? We're living in a twilight zone. We were immediately censored and as you said, shut down, cast off.
Yeah, yeah, and it's difficult. As I said once in a statement, I said if you are going to silence and censor, you have no leeway to make a mistake. It's a really important point because it means, therefore, that you are stating that your position is correct and anyone else's position who disagrees with is incorrect. And so, in that situation, how many chances do you get to make a mistake? That's really, I think, the challenge. You're not allowed to make a mistake because you didn't take everything into consideration. Any thoughts on that?
Well, yes, here's the problem with emergency situations, Philip. The problem with emergency situations is that we as leaders will have to make decisions on incomplete information. That's a problem. But here's the deal. This is where I believe public health went wrong. When we don't know something, when we don't know something for a fact, then what we do is we say to people, here is what we know. Here is what we don't know. And now I need you to make the best decision for yourself and your family. When we make decisions on incomplete information and are wrong, people suffer, and they suffer massively, as we've seen during this pandemic. And so, in my opinion, if you don't know something, what you do is you make the best decision with the information that you have, and you empower people to become informed consumers of the information you're providing and empower them to do what's best for themselves and their families. You give them a choice. And during this pandemic, choice was removed to so many people. They lost livelihoods. Many people lost their lives. Many people lost loved ones. I'm a father of three, Philip, and the greatest memories I have in my life are seeing my children born. There were men that missed that experience as a result of this virus. And in my opinion, again, and this is my opinion as a public health professional, those draconian measures were never, in my opinion, justified to be put in place.
Yeah, yeah. Now, I'm going to be bringing in a central part of the discussion, and I'm going to start off with a recent change to the policy with regards to YouTube, their medical misinformation policy. And looking at it carefully, YouTube doesn't allow content that poses a serious risk of harm by spreading medical information that contradicts local health authorities or the World Health Organization's guidance about specific health conditions and substances. And this is looking at prevention misinformation, treatment misinformation, and denial misinformation. Okay. So the first thing is they have clearly tied their policies to the World Health and the local health authorities. And I think in terms of local health authority, well, let me just ask you your thoughts first on that. Any thoughts generally on that before I go any further with it?
Devastating. Absolutely devastating. Let me give you a real life example. There was a certain medication that was classified as a medication used for animals. That was discussed earlier on in this pandemic. And immediately the medical community went out and said that that drug was extremely dangerous. Now, as a public health professional who travels to foreign countries that have endemic malaria, I have not only taken those drugs safely for decades, but I have also given them out, and they're called Sunday Sunday. Now I'm talking about both of these drugs. They're called Sunday Sunday in parts of Africa where we give them out to treat prophylactically malaria. And when a medical community states that, this is a real statement that they made, and you as a public health professional know, because you've been taking these drugs for decades for malaria prophylaxis, when you censor someone for misinformation and you are the misinformer, that's criminal in my opinion. And so the statement that you've just highlighted on YouTube, in my opinion, is absolutely, it's scary. It's absolutely scary, because public health has been compromised by big pharma, healthcare doctrines, meaning doctors can't even creatively practice medicine anymore. The healthcare industry is telling them how to do it, and politics, and no one's saying anything about that. They're just saying, well, even though the WHO may be completely compromised and local public health agencies may be completely compromised, it's okay. We'll just take that information, and anybody who argues with it will be immediately shut down on our platform. That is, in my opinion, devastating news.
Okay. I'm going to come back to what YouTube has said in a second, and I'm going to ask you specifically about one part of it, because you were talking about there the treatment information. There's one on the prevention information where they don't allow content that promotes information that contradicts, again, health authority guidance on prevention or transmission of health conditions. And they haven't been very specific there, but since we're talking in the context of COVID-19, we can know what they mean. And again, promotion of specific harmful substances or practices that have not been approved. And I think where you are talking with the drugs, I think that's where it can be a problem, because some of these drugs are very safe, very valuable, and you don't want people to think that there is a problem with them. But I'm going to specifically ask you a question about denial misinformation. So I'm sure you've come across many comments or discussions that says something like COVID-19 does not exist. It's just flu rebranded, for example. What, from a public health point of view, would you do if you were therefore in charge? Would you consider that denial misinformation?
So you've asked two questions in one. Number one, do I think anything should be censored? Because that's an important question. And then the second question is if I was a public health professional and I'm serving people and they've said to me, Sean, COVID-19 doesn't exist. It's influenza in another form. My job as a public health professional is to alert them of when I would agree and disagree with them, but then to serve them right where they're at. So what I would say is, okay, I disagree with that statement. However, if you choose to believe that COVID-19 is just a new form of influenza, then let's find something that we can agree on. And here's what we can agree on. This infectious disease will pick on the elderly, those who have compromised immune systems, those who have pre-existing medical conditions, meaning if we call it COVID-19 or we call it asparagus soup, are there things that we can agree on so that we can work together to take precautions that are needed to keep you safe? Meaning, when someone chooses to deny something, to me, there's more to it. They could deny it because they're afraid. They could deny it because they have trust issues. the denial is part one. I still have to serve people in public health who deny that fast food is not good for them, who deny that smoking is bad for them, who deny that smoking is bad for others around them. I don't just give up on them. So if I'm censoring people who are denying, then I never have a chance in public health to serve everyone, because I'm just going to assume that no one is denying that this exists.
Yeah, I understand, and I think that I get the point even in the chat, and I'll show what Betty has said. They never showed the isolate like other viruses, and I think I understand where they're coming from. There seemed to be an issue with regards to demonstrating the science early
Yeah.
on with regards to showing the virus. I mean, maybe it has been that public health has assumed that this is obvious and not gone about the job of taking through people through the process and the science. Was that a mistake for them to just assume?
I listen. Again, I think that our job in public health is to inform people in ways that they can understand. So when an audience says, "Hey, this doesn't exist," and we know scientifically it does, we obviously are missing information that would allow the audience to become educated and informed. So to me, again, when we look at communication, it's our job to work. When someone says something, and it's our job to work, we have to look at not only what they said, but we also have to take what they said and determine where they are and what they're looking for. Meaning, when people communicate, it's important for us to not just listen to those words, but to actually try and understand the intent behind those words. And when someone comes up to me, Philip, and says, "Well, I don't believe the virus even exists," as a public health professional, I have two things going on in my head. Number one, I need to do more education and information on the actual virus and see if I can get them what they're looking for. But also, number two, I need to make sure that we can agree on something so that I can move them forward and keep them safer.
Excellent points. Excellent points. So I'm going to step into a controversial area here. And this is one of the things that I think is an issue for a lot of people, is that issue about masking and whether or not masks work and whether or not masks should even be used or shouldn't have been used in the pandemic. What was the mistake? Because interestingly, public health chose to say masks were not of any benefit initially, then changed their perspective and said not only was it important, it was essential. Is that where the problem lies with this question on masking?
So I'm going to use an analogy here, and forgive me, I like to tell stories, Philip, but I'm going to use an analogy. Out here in the U.S., if you're not here, there's Wendy's. You're familiar with Wendy's, right?
No, I'm
Yeah.
not.
It's a hamburger joint,
Okay, yes.
and my wife, tells me I'm not supposed to go and have a hamburger. Okay, but so I go out my day, and at the end of the day, my wife says, "How was your day?" And I tell her I had a great day, but I don't tell her I went to Wendy's intentionally because I know she's going to get angry. And the reality is that is considered lie and deceit, meaning when I intentionally leave something out, it's considered a lie, which is deceitful. The problem with public health during this pandemic was that the answer to whether masks work or not is they do work and they don't. And let me tell you how they do, and let me tell you how they don't. Now, it's funny because CDC in 2003 with the original SARS and even with MERS in South Korea did not promote the usage of masks. In fact, they promoted against it. But for some reason that changed in this pandemic. So let me tell you my perspective of how masks work and how they don't. If you are an individual that is sick, meaning you're sick, you have a virus or a bacterial infection that spreads through droplet transmission, and you want to practice a sense of courtesy and manners with the environment in which you're walking around in while you're sick, I would love for you to wear a mask so that when you cough, you're not necessarily spraying it everywhere. But if you are sick or if you are healthy and you think that a mask over your nose and mouth is going to stop droplets from entering your body, it's not. Now, it can keep your fingers from touching your nose and your mouth, which are mucosal areas. And if you get something on your fingers, it can enter your body through your nose and mouth. So it can provide a barrier. But the answer is that masks do work in some ways and they don't work in other ways. And no one ever really explained the difference between the two.
Yeah, I think that's a very important point that you make with regards to masking, my view on it is quite simple. I would say that if you did double-blinded studies on washing of hands, you would probably find that washing hands in the pandemic probably didn't make much of a difference. But the practice of washing hands has got to impact on the spread of infection, if that makes any sense. So, in the same way, everything is about layers and layers of protection. My worry is that as we move forward in the pandemic, we are at a point where people are kind of arguing about stuff that isn't really as important, because we are facing the biggest transition in the pandemic again. And people don't realize coming into winter, they've got a new variant circulating and it is spreading like wildfire and it will continue to spread. The big question really is there anything that we can do that could reduce the risk of infection and transmission? And if masking is shown to have some benefit, even if a little bit, would it be worth it? Is that a reasonable way of positioning that, Sean?
Well, yes, and this is where we get into public health. We lost our way in public health because we believed that physical health was more important than all the other types of health. And here's what I mean by that. There are some people that are not physically healthy, but from a social well-being and from a mental health well-being and from an emotional well-being and a fiscal well-being and I can go on and on. Well-being and health is more than just physical. And if a mask is going to give somebody the confidence to live a better life, to connect with people, to go to church or to school, or to go to a grocery store, or just to go back to a sense of normalcy, the risk of that they face by wearing a mask versus avoiding those things to live a healthier life is so much higher. And what I mean by that, Philip, is I want people to have the facts so that they can empower themselves and their families to do what they want to do. And if somebody says to me, Sean, I am not going out of my house unless I wear a mask, I'll say, wear a mask. And if somebody says, I don't want to wear a mask and I'm leaving my house, I'll say, you better take some extra precautions, not just for COVID, but for other things in life. I mean, again, I don't think it's my job as a public health professional to tell people what to do. It's my job to give them information in a way that they can understand and then empower them to do what they want to do. That's 27 years of my job has been doing that. And only once in 27 years has public health ever decided to become a dictator. And that was during COVID. And
Wow.
everything else. And yeah, I mean, seriously, it's sad.
Yeah. Excellent point. So I'm going to bring us to the paper that was recently published that seemed to cause quite a lot of arguments across the social media world. And this one was a public health paper, original investigation, communication of COVID-19 misinformation on social media by physicians in the USA. Okay. And this paper, I think, was just published in August. So it's just recently published. And they were looking at the misinformation propaganda, the types of COVID-19 misinformation propagated by US physicians after vaccines became available, the online platforms they use, and the characteristics of the physicians spreading this misinformation. So this is what they were looking at, and they did a number of searches. They looked at high use Twitter, Facebook, Instagram, Parler, and YouTube, and they were looking out for information that went against the recommended guidelines of public health at that time. Firstly, any thoughts about generally this kind of research?
Well, first and foremost, JAMA is huge. I mean, it's not just any public health publication. JAMA is typically what we like to say, kind of a gold standard in publications, at least here. And what stands out with what you've said to me is yet again the assumption that public health recommendations were right. And that, Phil, two things stand out right now. Number one, why are those who were wrong still leading? That's one thing that blows me away. Why are those who misled and still being the ones who are leading. That's the first thing that stands out. And the second thing that stands out is why why don't any of those leaders ever have debates with people like you and me and doctors who signed the Barrington Declaration? Why don't those individuals ever meet outside of the media, the mainstream media, or anyone else that just throws softball questions or barely has enough understanding of the information to truly push them as to why they've made the choices they've made? They're avoiding that. In the United States, we are winning court cases now because when it comes time to cross-examine those individuals for the decisions they made, they run. They will not go, they will not lift their hand up, swear to an oath to tell the truth, because they know there was never any science to back up the decisions they've made. There was never science to back up the censorship that they imposed on people. And my belief is you're going to have an avalanches of court cases where people who lost so much during this pandemic are going to be made whole again. And this is again a prayer that comes to me, because those individuals that were leading, I mean, you've already seen Dr. Walensky from CDC, gone. You've seen Dr. Fauci, gone. You see the NIH director, gone. They're all sipping Mai Tais and they're private islands at this point, and no accountability yet. And that infuriates me because those
Um,
individuals were wrong.
Well, I brought up a picture here that I had to laugh about when it said about who would get COVID and whether or not if you were vaccinated, you wouldn't get COVID. And so when we've got the circulating virus, suddenly everybody is saying that they never said that, but actually they did. But I do feel a little bit sorry for some of the people because they were taking advice from their scientific people who really probably believe that without actually looking carefully at the science. So they gave them information that would then embarrass them when it reverses. I mean, the minute you started to see breakthrough infections, that should have been a red flag. You shouldn't have people saying these things when the science is not fully understood, and therefore they put themselves in an untenable position where they are so confident in what they're saying without having a good understanding of the science behind it, because clearly they did say that, but it's because they didn't understand how the science actually works. That's a bit of a problem, isn't it?
The saddest part about anything in life is when people who speak the truth don't have a chance to speak the truth. The When you can't foster healthy debate in science or even in public health, when people can't hear from two different sources and determine based on what they see and what they read which source they're going to choose to believe, or they can maybe choose both sources, you've made a decision for people. Philip, you're absolutely right. Now in public health is not the time to shame or blame people. I really don't like the whole unvax vax. I don't like the people were injured because they never had a chance to hear the whole story. They never had a chance to be around someone who decided, or someone who stated that the narrative that was going on was not necessarily the complete story. Meaning, half truths are also half lies. And though the mainstream media and the public health authorities were speaking in half truths, that basically means they were also half lying. And that's where folks like you and me and professionals, a lot of them out there who I consider heroes, were screaming at the top of their lungs, you've got another thing to consider. And unfortunately, we were censored and pulled down. And so people had to make decisions on incomplete information because those who were opposing the mainstream media or the narrative, they were censored.
Mm. And this is likely to get worse. As I said, this was just published, and I'm bringing up the results of the study that they did. And the propagation, they found 52 physicians in 28 different specialties across all regions of the US were the primary drivers. 42 of the 52, 80% of them, posted vaccine misinformation. Then another 76% propagated information in more than one category. And most of them, they thought, posted misinformation on at least five or more platforms. Okay. And the main things that they were saying were: one, they were disputing vaccine safety and effectiveness. They were promoting medical treatments lacking scientific evidence or FDA approval. They were disputing mask wearing and other unsubstantiated claims. Example, the origin of the virus, the government lies, and other conspiracy theories. This is a bit of a problem because they have been doing this for maybe a year. So they are not seeing that actually a lot of what was said turned out to be true. It was considered misinformation at the time, but in reality, a lot of what was said turned out not to be actually false. Any thoughts on that?
Yeah, print that paper out because this is another example of how JAMA is also compromised. What was once a gold standard in research, harming people, and they themselves are misinforming people.
Sorry, Sean. It seems as though you've lost your mic there temporarily.
I
Are you back?
I Yeah, I'm back. I'm sorry. I don't know where I was left off. I just said take that article and get ready because that article is, I mean, print it out and hold on to it because you have an article that's claiming that you have an article that was claiming misinformation, but in reality, the information that was being provided was not misinformation. It was the information that was missing. You cannot ever declare that you can't ever declare that a treatment that has never been fully vetted in comparison to other treatments or proactive countermeasures over a decade, you can never claim safety and efficacy within a 6 to 7 month period. That is irresponsible. It's incomplete. It's deceit. It's a lie. The same goes with masks. The same goes with, as I mentioned earlier, treatments that public health professionals and medical doctors have taken for decades when they travel to areas where malaria is endemic. The reality is that the misinformers were not the ones that were not the ones that were censored. The misinformers were the ones that were speaking and educating the community.
Yeah, I think that when I looked at, they picked some specific examples, which I'll give a read out to them. One of them is that in terms of they claiming that vaccines were unsafe and or ineffective, one of the people said it is time to recognize natural immunity. Sorry, well, I'll read this to the audience. It's time to recognize natural immunity as at least or as good as vaccination and end the mandates. So this was considered to be misinformation. Sorry, Sean. Did you miss that there a minute? Can you hear me?
I did. I did. I apologize, Philip. I got you where you said they were claiming, and then
Yeah.
you dropped off. What were they claiming?
So they used an example, and so they highlighted the date it was posted on Facebook, and the statement says this was the misinformation. It's time to recognize natural immunity as at least as good as vaccination and end the mandates. So this was posted as misinformation on the 4th in April 2022. And I'm thinking to myself, why would they think that that is misinformation? When since did natural immunity become an issue? This is what I mean in terms of the damage that can
It's
happen to public health.
ugh, it's devastating. And in fact, if folks are at home right now, they can just go to CDC and look up things like measles vaccines and you can look up smallpox and you can look up chickenpox. I mean, listen, on the website, even of CDC, where vaccines are being recommended, it will say if you have evidence of past exposures and recoveries of disease, you do not need to be vaccinated. So why all of a sudden did natural immunity get a bad rap? It doesn't make sense.
Yeah, yeah. Um, I think that okay, so here's another one I'm going to show you again. I hope you can see it. I'll read it out for you if you can't. And
Thank
so
you.
this
Thank you.
one here is again where was it? This one. This question. If the COVID deaths are precipitously falling in several countries, regardless of the percentage of the population vaccinated, why are we saying that the fall is due to vaccination? So this was again in February 2022. And this was considered to be misinformation. I thought that that was a pretty good scientific question. That really is the question. If a country is not been heavily vaccinated and they are seeming to be doing well, that should be a question scientifically that you would say, well, how is it that they're doing well? Is there anything that we need to understand in order to try and understand to get a better grasp of how to manage the pandemic? Why would they consider that misinformation?
Yes, again, if you look up lies, types of lies, there are 7 types of lies. People can Google it right now if they're listening in. I think it says 7 types of lies will come up. And one of the types of lies is called a change of definition. So as you know, during the pandemic, there were lots of changes of definition: death, injections, the benefits. There are a lot of change of definitions, including what a pandemic was in the first place. I think JAMA, based on what you're asserting here, Dr. Phillip, has clearly redefined what misinformation is. It is clearly defined in that paper that misinformation is information that goes against what is the existing narrative, against or any type of information that's going to make the leaders of the past look like they are incompetent, look like they were misinformed, and look like they misled. And so that to me is what JAMA is doing in this paper. They have redefined misinformation and basically said you better get along, you better go along to get along. Otherwise, we're going to call you a misinformer and censor you.
Mm. And I'm going to show you another one here that they mentioned. And I think this one here, I think that I would probably agree with them here. They said triple vaxxed are dying more than any other groups. This was on Instagram, and this was in March 2022. Um, I don't know where they got the information from. And to be frank with you, I think that when I looked at certainly the UK data, that probably wasn't the accurate. I think the people who only got one vaccine were the highest risk, then two, and then three. And so this was probably not necessarily accurate. But the truth
Uh,
is that I question why people have to try and find these numbers. I would have expected that this kind of information should be out there, very clear to see how deaths were matching up based on vaccination status. That's science, and that's being objective and truthful.
Listen, the information that allows people to be educated and properly informed was incomplete. I'll give you another example. One of the greatest accomplishments during COVID for me as an individual was we beat the OSHA mandate that was going to require all businesses with 100 or more employees to be vaccinated. We beat them in the United States Supreme Court. I wrote a declaration for that case. And here's what blows me away, Phil. Are you ready? In the
Yeah.
490 pages of that document where OSHA tried to make its case, do you know how many times it mentioned the vaccine adverse event reporting system? And keep in mind that VAERS is run by FDA and CDC. These are two public health agencies within the Department of Health and Human Services. In the 490 pages they used to try to justify mandating this injection, VAERS was not mentioned one single time. Which means, in my opinion, again, it is important for us to go to the general public and say, you cannot believe everything you read. You cannot believe everything that comes across social media. You have to ask for references. You have to actually be a critical thinker of the information you're receiving. You have to ask questions from people that you trust. But censorship is certainly not the ideal way of keeping a general public engaged and informed during an emergency situation.
But we have a problem here, Sean, because the truth is that many people respond best to sound bites, to snappy things that they can say, "Oh, this is what this means," and because of, I guess, because of the social media environment that we're in, they are very few people seem to be doing critical thinking. And that's part of the reasons why misinformation can occur so easily from multiple angles, because people aren't actually doing critical thinking. And in that situation, what do you do?
Yeah, Philip, you pose a big challenge. Steve Jobs, I don't think it's rumored. I think it's a true story. When the iPhone came out, he didn't want his children to have an iPhone. And the reason why he didn't want his children to have the iPhone is because he knew that the analytics, or that the algorithms would allow the phone to identify what his children wanted and to see, wanted to hear, and would bring that constantly to his children so that they would continuously look at the phone. There is there is no doubt today that information travels to people in a way it didn't when we were younger. We used to argue over an encyclopedia. We were information deprived. We had very rare. We had to go to library for sources. But today people get it through social media platforms. They get it online through the web page. They get it through their friends. And the reality is that instead of censoring, we really do need to teach people how to take a look at information, to dissect it, to look at references and resources, to really become informed consumers of information, because they are literally drowning in it. It's not too little information, it's just too much, which is why those sound bites are so effective these days.
So we so where do we go from here with this, Sean? Because we have almost ended in a situation where people are entrenched in their views. You have some people on one side who are entrenched in the fact that, listen, the greatest thing that has ever been done in the context of the pandemic was that we vaccinated our way out of it. Then you have another group of people who are entrenched in the idea that the vaccines are the greatest danger to society. And there doesn't seem to be a way to pull them together. What does public health do in this situation?
That's a great question. So I spent many years counseling people, and then I transitioned out of counseling and went into coaching. And I'll tell you why. Counseling takes a look at things that have happened in the past and tries to make amends and peace with those things. And sometimes it works, and a lot of the times, anytime we bring up the past, there's a lot of pain. Public health historically has a lot of pain. There are lots of things that public health has done unethically in the past. In New Zealand, with the experiment with women who had cervical cancer, the Tuskegee experiment here in the United States. We could go on and on. My job as a coach, though, is to say, what do we want moving forward? What do we see public health doing moving forward? And the first thing that we have to do, in my opinion, is to rebuild public health and the trust that public health has lost. If half the group in the world says that public health did the right thing through a vaccine, then we only have 50% of the population to focus on, and quite honestly, that's a substantial amount. There are some people that lost so much that we really, in public health, have to come to the table and say, we got some things right, we got some things wrong. Some people benefited, some people hurt. We have to acknowledge pain. We have to own it. We owe it to the people we serve to investigate it scientifically, and we owe it to the people we serve to change and make sure that what went wrong this time doesn't ever go wrong again.
Mm. Those are some big challenges in terms of dealing with the past. But here's the
Yeah.
problem, Sean. As I said, now let me just put it into context. If my listeners want to understand where I'm coming from, as far as I'm concerned, I liken where we are now to the 1918 flu pandemic. In the first wave, 2 million died across the world. In the second wave, it was 50 million. Okay? So if we correlate that to where we are now, I consider that everything that happened in the past 3 years was the first wave, and we had about 6.5 million deaths. If we get what I am concerned about, which is that a variant that is able to quickly get to the lungs as well as evade interferon, similar to what Gert is talking about, that is a monster, and everybody is therefore at risk. The job is not done. How can public health prepare us for what could be a very serious situation starting very soon? Is there anything we can do?
I, you know, it's a very tough question. Is there anything public health can do? I think public health should be really working to gain people's trust again. But Philip, you've described a situation where where individuals are yet again going to have to be empowered to take care of themselves and their families. I hear rumors, as you have heard, that lockdowns, masking, things are coming again. Should this get out of hand and out of control? And I just, again, I don't know where to go, because public health to date is no longer serving its constituents. In my opinion, public health is serving politics, big pharma, and healthcare doctrines more than it is the general public. And that's what breaks my heart as a public health professional. So unless we shift away from big pharma, healthcare doctrines, and politics and start serving people, I don't know if there's much that public health will be able to do during the second round.
Yeah, and this is a challenge, because we need public health. We need the direction. We need the leadership. We need it to be free of politics and purely focused on science, and we don't seem to be able to get the politics out of this, because so many people are afraid of acknowledging errors because it comes with liability. And therefore, that means that we are entrenched in our position, and we're not flexible to be able to move quickly. I think that's the biggest danger that the world is facing.
Yeah, maybe it's called pride, and we've been warned by that in many different ways.
Oh, absolutely. I'm just going to go to the conclusion of this paper, and that as we're coming to the end of this, Sean, I'll be getting some of your thoughts on this. So when we look at the conclusion of the paper, so based on their conclusions, they looked at the U.S. physician propagation of COVID-19 misinformation on social media. Results suggest widespread, inaccurate, and potential harmful assertions made by physicians across the country who represented a range of subspecialties. And further research is needed to assess the extent of the potential harms associated with physician propagation of misinformation, motivation for the behaviors, and potential legal and professional recourse to improve accountability for misinformation. I suspect that this only works one way, meaning that it's only for those who are saying anything to challenge the narrative that are at this risk, not for people who may have gotten it wrong in the past. Is that fair?
It is a fair statement, but I also, Philip, and I know that you're a physician, and please know that I have such a fond respect for you and for all physicians and what they do. But please hear me and hear the spirit in which I bring this up. Physicians, at least the ones that I am very well aware of, there is a specialty that they have that is infectious disease. There's no doubt that there are physicians out there that have a specialization in infectious disease. And typically they use that specialization to treat cases that cannot be generally treated by first line or second line physicians. And the reason why I bring this up, Philip, is because as a public health professional with 27 years of experience, it is very frustrating to see that an OBGYN or a neurologist or I could go on all these other, specialties. That MD behind a name does not mean they are credible when it comes to infectious disease. And that was very, very frustrating. Again, I think JAMA has changed the definition of misinformation. And even with the statement that that MDs should be given credible information, because quite honestly, MDs make mistakes. And they also talk about things that they don't know very well. I doubt that most MDs would have even known that SARS was, that COVID-19 was a coronavirus. That endemic malaria is treated with ivermectin or hydrochloroquine. Look, the reality is that credible sources of information, it doesn't come with MD. It comes by researching who the MD is. Same goes with public health. When public health professional says something, take a look at their experience. Philip, you have an impressive background. ladies and gentlemen, I have 27 years of dealing with pandemic, endemic, and epidemic infectious diseases and human behavior. And I get shut down on Twitter, Facebook, YouTube, and why? It's not the 27 years of experience working directly with dangerous pathogens. No, it's because what is being said is wrong, and the misinformation that they said I was providing has been nothing but truth. And same goes with you, Philip. And that's a
Mm,
disappointment to see in JAMA. And I bring that out because people also have to know you don't go to a gas station, in my opinion, to buy clothes. Now, granted, they may have a T-shirt. You go to a gas station to get gas. When you go to look for information about infectious diseases, I beg you, go to an MD with an infectious disease background or specialty. Go to somebody who's done infectious disease research for decades, but don't go to a politician or a healthcare CEO or a big pharma rep. You're just going to the wrong places for that information. This is part of being a smart consumer of information.
The interesting point you make there, Sean, and actually I was reflecting carefully. I'll make this point here. One of the problems that we've had with COVID-19 is that it's a multi-specialty disease,
Yes,
meaning that who actually is the expert? Is it the infectious diseases? Is it actually the respiratory? Because they usually die of
yes, yep,
respiratory disease.
yep, yep.
If it's a cytokine storm, is it the rheumatologist? And suddenly you have this blend of expertise that is happening. And I think this is what has caught a lot of people out. So the infectious diseases would go in with an infectious diseases mindset, not realizing that actually the most important thing to understand is the cytokine storm. If you had put the rheumatologist in, they wouldn't quite grasp the infectious diseases implications of spread. And so you have this complex disease where you do actually need multiple levels of understanding and a broad experience with healthcare in order to get to answers. I
Philip,
think that
Philip,
Hmm,
I don't mean to interrupt you, but I have to because anytime you treat a patient, that should always be. We've talked about this for years in healthcare, and you know that. Instead
hmm.
of having one main doctor, if you had a specialty team that looked at your problem from a variety of different angles, you would always get the best care. So you are absolutely right. I'm sorry to interrupt you. I had to just inject that. Absolutely.
Yeah, and I think that this is part of the problem now. And even going forward, the reality is that my prediction, based on the research I've been doing, is that the primary mechanism for severe or complications around the infection is going to be immune mediated. And so, even though infection is an important part of it, the primary people who should be involved are actually immunologists or rheumatologists trying to figure out how to settle down some of the immune mechanisms that we're going to see. And they are definitely not at the forefront. Actually, I think they specifically want to stay in the background because they don't want the headache. And so this is why I am very worried that we are moving into a phase of even more confusion when we start to see the multiple presentations that will occur around COVID 19, because it will not be severe lung disease. We'll just see people getting sick and dying and not quite sure why. That's very difficult to manage.
Absolutely. Absolutely.
So final thoughts, Sean, as we close out.
Philip, I want to first and foremost, if people are listening to this, I want to thank you for continuing to try and stay informed. And again, take a look at everything that's said, and don't just believe it because it was said. Just become an informed consumer and consider it and critically think about it. And of course, Philip, as always, Dr. Philip, it's an honor to be with you here, and I thank you for all of the hard work and the sacrifices and the risks that you take to tell the truth, because you are telling the truth, and you need to be heard. So again, I appreciate the opportunity to be with you here today.
Wonderful. Thank you, Sean. And just for the listeners, just to remind you, coming up next week on the Saturday and the Sunday, post COVID, long COVID Congress. And this is looking at international group of speakers. They're challenging what we know and primarily what we're likely to expect in the next few months and years of the pandemic. And so this is why I think some people can look at the word long COVID and it triggers a negative or a response from them. I'm telling you that this is absolutely critical for everyone to understand, because it has an impact on everyone, you and your families, because that's how we're going to see severe diseases presenting over the next few years. But yes, look forward to speaking to you all again. Thank you again very much, Sean, and I hope you all have a great evening. Thank you very much.